Medicines for children. Practical and reliable advice about giving medicine to your child. How to give a part dose of a tablet or capsule. It is very important that you are able to give the correct amount of medicine to your child. Many medicines only come in tablet form. You might need to give your child the whole tablet, but sometimes you will need to give only part of a tablet. In this film, we will show you how to do this. You should watch the film all the way through to the end before giving the medicine for the first time. There are many different types of tablet. Most can be swallowed whole, some can be crushed, some can be dispersed in water, and some will melt on the tongue. Your doctor or pharmacist can explain more. To administer this medicine, you will need the tablet, an oral syringe, a tablet cutter, 2 teaspoons to crush the tablet, or a tablet crusher if available, a small glass to dissolve the tablet in, and a drink for after the medicine to take the taste away. Wash your hands with soap and hot water before starting. The first thing to do is check the label to make sure you know which medicine you are about to give. This is especially important if you have more than one medicine to give. The label will have the name of the medicine, the strength, the amount to give, and your child's name. In order to give a part dose, your doctor, pharmacist or nurse may tell you to disperse a tablet in a certain amount of water and give only part of the dispersed medicine. For example, to give 30 milligrams of a medicine that is only available in a 50 milligram tablet, first you will need to pour some water into a separate glass or pot, from which you draw up 5 ml of water into an oral syringe. Once the tablet is dissolved, you will give only 3 ml of the mixture using an oral syringe. You can get an oral syringe from your pharmacist. For babies less than 6 months, you will need to use water that has been freshly boiled and then cooled. Put the tip of the oral syringe into the water and pull the plunger back so that the top of the ring is at 5 ml. You have now measured 5 ml of water. Next, you will need to squirt the 5 ml of water into a glass or pot. Aim the syringe into a glass and push the plunger in slowly so that the water goes into the glass. To get the right amount, tablets may need to be halved or quartered first using a tablet cutter, which is available from your pharmacy. After this, most tablets can be crushed before being added to water to speed up the dispersal process. We recommend using 2 teaspoons over a small plate to crush the tablet. Now you will need to disperse the tablet in the water. Place the tablet in the water and mix the liquid vigorously. You can use the end of the syringe to do this if you like. It may make a cloudy mixture. Next, you will need to measure the correct amount of medicine for your child. Draw up the right amount for your child into the syringe. The amount of medicine will have been calculated for you. If you are not sure about the volume, contact your pharmacist, doctor or nurse. For this demonstration, we are using 3 ml. Giving the medicine can be tricky. Place the tip of the syringe in your child's mouth and gently squirt in the medicine. For babies, it's often best to squirt the medicine down the side of the mouth next to the cheek, so they do not choke. If you need to give a large amount of medicine, then it's best to give it slowly in small amounts. Older children may prefer to give the medicine themselves. You may want to have a drink ready to take the taste of the medicine away. Some medicines can be mixed with a small amount of juice or milk. Your pharmacist can give you advice about this. The same process can be used for capsules. In this case, you will empty the contents of the capsule into 5 ml of water. Dissolve the contents of the capsule in the water and draw up the required amount of liquid. Once you have given the dose, wash the syringe straight away using fresh soapy water. Draw the plunger in and out in the soapy water several times, then rinse the syringe in clean water in the same way. If any mixture is left over, make sure to dispose of it immediately. Do not pour any unused medicines down the sink. Instead, pour into a tissue or paper towel and put it into the bin. If you have any questions about this or are not sure about anything, then ask your doctor, pharmacist or nurse for advice. Medicines for Children is a partnership project of the national children's charity WellChild, the Royal College of Paediatrics and Child Health, and the Neonatal and Paediatric Pharmacists Group. You can find our information leaflets and more films about giving medicines to children on our website www.medicinesforchildren.org.uk.